It's like getting to experience magic at work. It's like getting to see my patients light up and sparkle when they just planted a flower that they know another patient is going to see.
Being able to care for something else while you were being cared for in a hospital setting is incredibly valuable. I think we forget that.
So the gardening program here is an incredible collaboration between many different staff members and community members here at Duke Regional, as well as staff and experts at the Duke Gardens. And so here at the Behavioral Health Center, we work together with residents, recreational therapists, and behavioral care techs to deliver high-quality gardening program and interventions to our patients. And then we learn from and get support from our colleagues who are at the Duke Gardens.
I like to see the joy in the patient's face when they out here getting their hands in the soil and commenting about how pleasurable it was for them.
Duke is blessed to have a built-in garden attached to our inpatient unit, and that's a real rarity, especially in the region, but even nationally. So we set out to try and maximize that space. So the gardening program, along with our patients and our staff, we plant seeds, we plant bulbs, we tend to the gardens. They've produced flowers, herbs, and vegetables. But year-round, we're using the space to help patients get their hands in the dirt, reconnect with nature in a bunch of different ways.
We'll talk about resiliency and what it means to continue to grow in the midst of adversity. We talk about self-esteem, coping tools, and leisure skills, and we're able to use this really hands-on experience with our patients to reminisce about their past being in nature, being with family and gardening, while also learning new skills that they can take on and implement in their lives when they leave.
The patients that we take care of here on the inpatient unit are going through a hard time. I think so much of the experience of the mental illness can be incredibly dehumanizing. The real benefit and great thing about our program is that it gives some of that humanity back to our patients.
Even if you're just taking a plant in a pot and you're putting it into the ground, just here in front of us, just that whole procedure of opening up the ground and digging a little space to put it in, your mind can wander and your mind starts thinking of other things than just what's going on in the world.
It's very calming to the patients because it distracts them from whatever issues that they might be facing and gives them something else to think about.
The feedback that I've heard that's most meaningful is people talking about their childhood experience. We've had folks say, I haven't planted a seed since I was living with my grandmother, and we would plant petunias or we'd plant sweet potatoes or whatever it might be. And they just go to these incredibly warm places in their mind and these memories of childhood and adolescence being in gardens with people who were important to them. That's the most powerful thing, to know that we can bring a little bit of that into the future, into their current life, regardless of what else is going on.
I also think that plant prescriptions are a pretty unique part of our project.
So in the same way they might be prescribed a medication when they leave, we prescribe them a plant. They're little jade plants normally that come home in a Dixie cup.
So that they can continue their gardening and continue their access and exposure to green things once they leave the hospital.
And part of the research behind that is we know that giving people that responsibility, giving them something to care for, has profound benefits for people's mental health and health overall.
Well, I think one of the special things between Duke Gardens and Duke University and Duke Hospital is that the proximity that we have.
And I think that partnership and that proximity is what allowed this project to happen.
So in addition to getting incredible knowledge and resources and then tangible things from Duke Gardens, we also kind of see it as an opportunity for patients to have a place to go to continue to be in nature once they leave the hospital.
And I honestly have to catch myself sometimes when I'm gardening because I'll forget. I just kind of click into gardening mode. And I hope that the program provides that same experience for patients too, that for that moment, they can forget that they are a patient.
We let patients know that they're not defined by their psychiatric illness. And it's a way for us to connect with them and for them to connect with themselves as well.